My name is Gretchen Bush. I am 53 years old. I am a native of Denver, Colorado, and I had a deep plane facelift and an upper bleph. So I had been thinking about considering getting work done for years. I'd been getting Botox for probably a decade, a little filler here and there. And as much as anything, I think the thing that brought me in is I have two older sisters who are 17 years older than me. So it's kind of a nice way to look into the future and see where things are going. And I started to notice some jowling around my chin. And as I looked at my sisters, I saw that that was only going to get more pronounced with time, and it really bothered me. So it was that brought me in. And then I've always had really heavy eyelids, to the point that about a year before I came in to see Dr. Weber, I just had to completely stop getting Botox in my forehead because I needed all of those muscles to keep my eyes open and not look like I was half asleep all the time. I chose the practice as I was going around to different providers. You know, I've done RF microneedling, all these things that we do to try to stave off time a little bit. And as I would talk with each of my various providers, my estheticians, my woman who does my Botox, that kind of thing, I would quiz them and say, what do you know about the various surgeons in town? And without fail, the first name that always came up was Dr. Weber. They had patients that had really good results. My esthetician was a patient here, and also a number of folks mentioned how he's out in the community going to other providers, doing trainings and that kind of thing. And that really led me to believe that he's somebody who knows what he's doing and would be a really good choice. I was really nervous and hesitant. You know, I think that there's a natural risk with any sort of procedure. And the thing that was important to me that I've always said is I draw the line at general anesthesia for elective stuff. So it was super important to me when choosing a facial plastic surgeon that there were different sedation options. And I really liked what Dr. Weber's office provided. It took away a lot of the anxiety I had around anesthesia and the risks that come with that, and just made the whole process a lot easier. You know, the entire staff at Dr. Weber's office made me feel incredibly confident. From the minute I walked in the door, everyone on the staff is so incredibly professional in how they handle new patients. They're welcoming, they're kind, they're really easy to talk to. And so not only was I really confident in Dr. Weber's capabilities, his staff, the level of training, the information that I got was all second to none. The morning of the procedure, and my husband brought me, I had been really prepped incredibly well by staff in my pre-op appointments as to what to expect. So I showed up in my little Viore sweats and was led into one of the lovely waiting rooms, and I elected to just have the oral sedation because I wasn't particularly nervous about the procedure itself. And it was just lovely. Everyone was so incredibly friendly. I took the sedation pills and sent a quick text to my best friend, and I hardly remember anything after that, which to me is a pretty good thing. Recovery was good. Again, I think that, 90% of the battle is managing expectations. And so Dr. Weber's staff had been phenomenal about explaining what to expect that evening, what to expect the next day, the few days after that, and when realistically I might feel comfortable going out in the world again. So from that perspective, I felt like everything progressed as I had been informed and as I expected it to. The first couple days were a little rough, but again, because I was so well prepared, it didn't really faze me. So it all went really wonderfully. I think I was actually surprised as to how quickly following the surgery, I was able to get in the shower and wash my hair and just kind of have that good feeling of being clean again. It was really wonderful, and they were so wonderful about explaining the aftercare, providing necessary antibiotic ointments and that kind of thing, that it really made the whole process very easy, reduced my anxiety. Oh, I love my results. It's a little bit embarrassing to say that my camera roll is so full of selfies over the last 6 months. I'm a little worried that when my family gets into the cloud, they're gonna be like, wow, mom is really self-centered. But I'm just so pleased with it. Having the opportunity to retake professional photos for my work and, have a photo that pops up on people's phones on my iPhone when I call them that I'm proud of makes an amazing difference. So I've got 2 experiences in terms of friends and family input that I absolutely adore. One, it was probably about 4 months after my surgery, and I was having lunch with a client in Cherry Creek, and an old friend that I hadn't seen in probably 15 years walked in, and he came up to the table to say hello, and he gave me a hug, and he looked at me and he's like, you haven't aged a minute in 15 years. You look amazing. And of course I didn't say why I didn't look like I had aged, but it really stuck with me. And then the other thing that really sticks out in terms of friends and family feedback, my daughter told me that she's like, oh, now we look more like sisters, Mom, which I'll take that any day. I feel like the main impacts of the surgery are just my level of confidence. Feeling, instead of standing in the mirror and constantly pulling and trying to figure out what I might look like if it looked different, now I look in the mirror and I know. I'm incredibly pleased. I think I was probably thinking about a lift for maybe 2 years before I did it. I was definitely thinking about the upper bleph for 3 or 4 years. And I tried everything I could come up with on the upper bleph before actually going under the knife. I was putting goofy stickers on my eyelids and what have you. And just, if there was one thing that I think I could have done differently, I would have done that surgery 3 or 4 years sooner. I would have loved to. If I could speak to my past self prior to surgery, I would say go for it. It makes an amazing difference. It takes a little bit of coordination and a deft hand and managing your schedule there for a few weeks while you're not ready for prime time, but it's incredibly worth it in the end. Oh, any advice for anybody considering this surgery? I think, as much as anything, listen to Dr. Weber's staff. Pay close attention to all of the aftercare instructions, get yourself all ready, and make sure you have everything at home that you need just to make it as easy as possible. But I would also just say go for it. I would absolutely recommend Dr. Weber. He is an artist. I was so impressed with my initial consultation with him. I didn't really know what I was after, except that I wanted these silly jowls gone and I wanted my neck to be a little bit less turkey-ish and what have you. And he was able to take a look and really quickly just say, this is what I think is going to work best on you. This is why. These are the risks. Here's what it would look like. And I was just so impressed with, like I said, the professionalism and the fact that he knows his stuff.